We're called Pure Kentucky, and it stands for Providing Ultimate Recovery in Eastern Kentucky. This is all of our team. I'm not going to read them because it takes so long.
What is our problem of practice? Our problem of practice is the lack of education and resources on the opioid it's okay. On the opioid addiction in adolescents in Eastern Kentucky. We are trying to prevent people from getting opioid addictions and to help people who are already suffering from said addictions. We know this is a problem because in our town there are an estimated 1,000 people that are already addicted to opioids, and that's a third of our population. There are 3 new reports each month on children 12 and over that are using opioids. Also, less than 10% of opioid addicts are able to stop using them. Staff from the Health Services Mountain Comprehensive Center has said that many of the children that come there have foster parents because of their biological parents' own addictions already in the home. And there's not enough education for teens and young adults to show how dangerous abusing opioids are.
Okay. So social media will be used to influence and spread the idea and problem of opioid use in our home county of Johnson County. Many people and families have been destroyed due to this addiction. Maybe by spreading awareness on social media, people addicted to opioids will hopefully start to distance themselves from these life-shortening drugs. Help us save families and the lives of today's communities in Johnson County. Our social media accounts are useful to our solution because social media is one of the main sources of communication in our generation. The social media accounts will be used to create anonymous group chats where ongoing addicts can talk and express their thoughts and addiction of opioids. We created a website where, like I said, there will be anonymous group chats. We hope to create an app that will connect the addicts to doctors and the volunteer crisis workers where the addicts will also be anonymous. All ideas that we are pitching, we hope to be able to go through with success. Facebook ads and billboards will be used to promote and spread awareness. We have looked at prices of these advertisements and have priced them in our budget. These ads will help put our website and other social media accounts out through Johnson County. The last idea that I have for you is hashtags for Instagram and Twitter, Facebook, and Snapchat filters. These hashtags and filters will be used to show the county how bad the problem is. Our hashtags are hashtag meth me up and hashtag hit by heroin. Our hashtags reflect our Facebook and Snapchat filters, which we are going to create that show the effects of drug use on your face. By using the filter, they will then post their pictures with one or both of the hashtags on one or all of our social media accounts or tag us. If we all band together, our team can make Johnson County a better and safer place.
What resources and personnel do you need to implement your strategy? We would need to use many people from the community, like social workers, doctors, nurses, and CEOs of companies. Some of the resources we would be using would be social media, billboard, ads, and posters, and also radio commercials.
So, as Jordan mentioned earlier, we have a website and hope to get an app, but we currently have a website that's already up. And it's called Pure EKY. So here we have a home tab. If you scroll down, please, you'll see a welcome. Keep scrolling down, please. You'll see a little bit about us. You'll see some of the things we have. So we're going to have some public service announcements over WSIP. We are socially flexible with our social platforms. We have 24/7 chat support on the website, and we also have forged some friendships and alliances in Operation Unite today, and they have allowed us generously to put their hotline on our website. So now we have that for people. And we have a quote here by Socrates to hope to influence people. The secret of change is to focus all of your energy not on fighting the old, but building the new. And if you click here on this button right underneath it, it says don't be the first one there. And it will take you to our contact tab. This way you can put anonymous in the name section. You don't have to have an email. You can put a subject, and then you can message us, and then you can reach us. This is links to all of our social media. And if you go up, you have the tabs, the About tab, which was in the first part. It's just a little bit more than what's in the first part. Then we have a Meet the Team tab. If you'll click on that, please. It just has a little bit. It has everyone's respective job title and their names. Then if you go to Problem and Solution, please. It tells about what the problem is. Talks about the 1/3 here. And if you go down, we have how to spot abuse of opioids. We have some signs here. If you keep going down, we have how to respond to an overdose. And if you keep going down, we have treatment and recovery. We have names, phone numbers, times, IPOs, EOPs, residentials. So that's all we have for the website.
Okay, so our research question is basically just how does the abuse of opioids affect the people taking them and the people related to them? And we've made a survey that's going to guide us. It's on surveymonkey.com. We've had some people in our school take it already, and then we're going to have the rest of the school and then people in our community take it. And that's going to help us make decisions on how to use our budget and what way to go with our solution.
What outcomes will prove that our innovation has succeeded? Some outcomes that will prove our success is the amount of clicks that we have on our ads on the social media, the number of people using Facebook Messenger and the website chat room to discuss their addiction, which we hope will be a lot of people, the amount of people using the hashtags, which are hashtag meth me up and hit by heroin, the amount of people using the filters on social media.
And we also have how will you measure these outcomes? The way we will measure these outcomes is by keeping logs and tables on who visits our websites and takes our survey. And the chat room will be anonymous, so we will log how many people take it, but not who they are.
All right. How can you be sure that only any positive outcomes on these measures are actually due to your innovation and not something else? We can measure positive outcomes by monitoring how much our education and resources are being used. We can see that the word is getting out and is being spread. We can also use SurveyMonkey, the survey, to view the positive outcomes. After implementing our filters, our ads, our posters, etc., we can have everyone take the survey a second time and compare the growth between the first and the second surveys.
Okay, so our budget would be around roughly $1,235. But now this is leaving room for other things that come up. Our website domain would be $12 a year. Snapchat filter that covers 20,000 square feet would be $5. The radio commercial would be $200, and the billboard would be about $1,200. But we have found sponsors for those that are willing to pay for it for us. And they would be advertised as public service announcements. And then we have left room for 300 views per ad on each social media platform.
Okay, we as an organization realize that this epidemic has planted itself within our home. Our small town is plagued with the ratio of 1/3 of our population is addicted to opioids. We plan to use modern forms of communication such as Facebook, Twitter, and Snapchat to spread awareness about the epidemic and to use our website to offer help to those in need with things such as anonymous discussion boards and an addiction hotline that we are partnering with Unite. We also will advertise with radio ads and billboards funded by generous sponsors, and hopefully with our effort within our effort we will use all forms of communication and we can see the ratio of the addicted reduced to non-existence.